Hello and welcome to the show. Today we are going to meet and have a chat with the founder of the Global Initiative for Traditional Systems of Health, UK. He is also a person who researches and advises on the international public policy on traditional, complementary and alternative medicine. Let us welcome Professor Gerard Bodekar to the show. Hello sir, welcome to our show.
Very nice to be here with you.
Before going to the inner topics of Ayurveda, we would like to know more about you and your education.
I'm Professor Gerard C Bodekar. I hold an appointment in epidemiology at Columbia University in New York and an appointment in primary care health sciences at Oxford University in England. And I chair an international research and policy initiative called the Global Initiative for Traditional Systems of Health. My doctoral studies were at Harvard University, and even then my focus was on traditional medicine in public health and policy. And I did my doctoral research on Ayurveda and Chinese medicine, looking at how both India and China had incorporated traditional medicine into national health care, and how that could be a reference for other countries in the future wanting to do the same.
When did you discover your interest in the field of Ayurveda?
As a university student, I'm Australian, and so I was born and grew up in Australia and studied there before I left and went to the US to do my doctoral studies at Harvard. And while I was a student, I became interested in meditation and healthy lifestyle and so on. And so I learned meditation 40 years ago. I learned transcendental meditation, technique brought to the West by Maharishi Mahesh Yogi. And I've been doing that every day, twice a day, for 40 years. And I also do yoga every day. And in 1981, I came to India, to Delhi, for a course on Vedic science that Maharishi Mahesh Yogi had organized. And one of the main sessions there was an introduction to Ayurveda by the late and very great Vaidyacharya Dr. Brihaspati Dev Triguna, who at the time was president of the All India Ayurveda Congress. So Dr. Triguna explained through a translator the fundamentals of Ayurveda. He explained the organizing principles of physiology in Ayurveda that are deeper than our understanding in modern medicine. Modern medicine starts really with chemistry. Ayurveda starts with physics. And modern medicine hasn't quite got to a comprehensive understanding of the physiology through physics. So I was very fascinated with this and felt I had to learn more. And so I came back the following year and I spent some time with Dr. Triguna. And after that I went to America, and the following year I began doctoral studies at Harvard. I began working as a researcher at Harvard, and then I began my doctoral studies and decided to go more deeply into this. So I've done lots of subsequent study in Ayurveda and have been on the board of the Institute for Ayurveda and Integrative Medicine in Bangalore for a decade or so. And I'm a senior editor on the Journal of Ayurveda and Integrative Medicine, so I keep closely connected with Ayurveda. And in my appreciation of Ayurveda, I see that it's very, very sophisticated through its diagnostic system in detecting early stages of imbalance which can lead to disease. It's an excellent preventative system. Ayurveda also offers lifestyle guidelines, daily routines, seasonal routines, individually tailored routines according to a person's doshas or individual body style. And this is in Western medicine what we call personalized medicine or personalized healthcare. Ayurveda's been there already for several thousand years. We're just getting there in modern medicine. So there's a lot to learn.
Yes. In your point of view, what is the role of TCAM in the modern world?
TCAM is the abbreviation for traditional, complementary, and alternative medicine. My colleagues and I were commissioned by the World Health Organization through our group at Oxford University to map these trends globally. And what we found was, put simply, the majority of the world's population are using traditional and complementary medicine on a regular basis as part of their health care. In some parts of the world, it's almost the only healthcare that people have. In the West and in wealthier parts of Asia and the emerging economies, interestingly, there are two clusters. The more affluent members of society are using traditional medicine with modern medicine. They're choosing it. In India, there's a big trend towards using Ayurveda. Also, in the same countries, the very poor are using traditional medicine because they can't afford modern medicine. And in the middle, you get a lot of people using modern medicine predominantly, and when they become more affluent, they move to Ayurveda and so on. So put simply, the global picture is the majority of the people in the world are using natural healthcare approaches. Also put simply, the majority of the healthcare systems of the world are still catching up with the public.
How does Ayurveda communicate to the rest of the world?
That we found in the global atlas that we did for World Health Organization, mapping the growth of traditional and complementary medicine, that Chinese medicine is far more globalized than Ayurveda. The reason seems to be that Chinese medicine's globalization is led by the public sector, by the government, with a very clear strategy. Ayurveda's globalization has been led by the private sector. So a company will go here and sell their products, a company will set up a clinic there and promote their services, and so it's less integrated. Ayurveda is certainly out there in the world, but it's not as comprehensively licensed or regulated as Chinese medicine, because Chinese medicine has been driven by a very well thought out state agenda to find a home for Chinese medicine in the countries of the world. Ayurveda has not been led in that same way, and it does need to be. So how does Ayurveda communicate with the world? Stronger leadership from the center in ensuring a regulatory acceptance of Ayurveda in the countries of the world, of practitioners, services and products, and education. Also, Ayurveda can communicate through research. In my lecture yesterday to the Global Ayurveda Festival, I mentioned the point that a principle of Ayurveda is that wherever there is a disease, nature provides a cure nearby. So if we look at the 11 goals of the National Health Mission of India, around half of those goals could be effectively treated and addressed by Ayurvedic means, and they are not being done so. Dengue, there is no known treatment, except that in the rural areas of Malaysia, rural villages have been using papaya leaf to treat dengue. Now, the Institute of Medical Research in Malaysia has done two studies, first on a single patient, and they found that this patient, the hemoglobin levels went way up and the symptoms improved very quickly with just a simple drink made out of a fresh crushed papaya leaf, not boiled, not dried, anything, just crushed up in a mortar and pestle, sieved, mixed with water and consumed a couple of times a day. They then expanded that to around 240 patients with both dengue and the more advanced form of dengue hemorrhagic fever. They found the same thing, very rapid increase of hemoglobin levels and improvement in clinical symptoms. India is not doing research on this, as far as I'm aware. India has the highest level of dengue in the world. India also is the largest producer of papaya in the world. Wherever there is a disease, nature provides the solution nearby. All that India has to do is link that excess of dengue with the abundance of papaya and put the two together through a process of research and community outreach. It's not being done. How can India communicate Ayurveda to the world? This is one case where India can offer a cure and possibly a prevention for dengue, currently an unpreventable, uncurable disease, through simply using papaya leaf. That's how India can communicate. Do the research. Malaysia's begun it. India has a huge population, has the highest incidence of dengue in the world. Maharashtra has the highest concentration of dengue cases in India. Do a study on 20 villages in Maharashtra, 100,000 people taking papaya leaf daily to prevent dengue. Look at another part of Maharashtra, no papaya leaf. Compare the dengue rates. Very, very simple study. It just needs commitment and resources. India has the money. It has the scientific capacity. It just needs the recognition that it has the answer. Prove it and use it.
What is the role of Ayurveda in fighting against malaria?
I chair an international network called the Research Initiative on Traditional Antimalarials, which was set up 15 years ago with financial assistance from the World Health Organization's Tropical Disease Research Program. We now are in many countries throughout the tropical world where malaria is present, and we're looking to find local herbal solutions to prevent and treat and control malaria. In India, a lot of research has been done on anti-malarial plants. There are many anti-malarial plants in India. Currently, the main class of anti-malarial drugs comes from a Chinese plant, Artemisia annua, Chinese wormwood, Qinghao, and the chemical extracted from this, the sesquiterpenoid artemisinin, is the basis of a new class of drugs. So India is treating malaria with a drug derived from a Chinese plant, when India has quite a few anti-malarial plants herself. Is this necessary? So what we know from Ayurveda is that Tinospora cordifolia, a vine with a big leaf, sometimes known as the heartleaf moonseed creeper, known in Sanskrit as guduchi, has anti-malarial effects. The neem tree, Azadirachta indica, also has anti-malarial effects. I believe that Andrographis paniculata also has anti-malarial effects. There are many plants with anti-malarial effects in India. Neem is effective, but with prolonged use can damage the liver. Tinospora cordifolia grows anywhere in the tropics. It's easy to grow. The problem is stopping it growing. It will take over a pergola and it just needs to be pruned. Pruning Tinospora cordifolia gives you the stem, which is anti-malarial. If that's powdered, it's very bitter. It can be taken with jaggery to make it palatable. Jaggery is high in iron and can reduce anemia. So combining Tinospora cordifolia guduchi with jaggery can prevent both malaria and anemia. Is this being fast-tracked in India? Sad to say no. India still has malaria. It's one of the 11 goals of the National Health Mission. Why are we using a Chinese-derived medicinal plant drug to treat malaria in India when you have your own growing abundantly everywhere?
What are your ongoing researches, sir?
I have a number of different interests and involvements. My group at Oxford is supported by the European Union in a project to train scientists in Africa in best practice in the study of African medicinal plants for common illnesses, to enable African countries to produce a range of safe and effective herbal medicines for common illnesses. At the moment, herbal products in Africa are very much raw materials from the market and from traditional healers. And this is really to move it onto a level of safer, more standardized herbal products for African consumers, familiar and desired products, but in safe and effective format. So that's one of our big projects. I also am very active in the field of wellness and writing about this, doing research on this. 53% of deaths in India are from non-communicable diseases, in other words, from lifestyle-caused diseases. 53%, the majority of deaths in India come from lifestyle-linked diseases. Wellness is very important in this. Wellness means healthy living, positive state of mind, fulfillment in work, happiness, and so on. It's not just trivial or a luxury. It's a way of preventing the leading cause of death in India and increasingly around the world. So this is an important part of my focus, and I'm pleased to say that Ayurveda, through its approach to lifestyle, dinacharya, ritacharya, daily and seasonal routines, offers personally guided lifestyle approaches to prevent lifestyle diseases. So I think in this area, Ayurveda has more to offer than any other natural healthcare system of the world.
Last but not least,
Yeah.
we would like to know about your experience in the Oxford University and also the Columbia University.
I've been at Oxford for 21 years now, and working on traditional and complementary medicine with my colleagues. We've done a lot. We've done work with World Health Organization, other United Nations organizations. I have to say that the UK is more conservative than the US, and my colleagues and I in the US have been able to do a lot more in that more open and creative environment than we have scientifically in the UK. But we've run courses for Oxford medical students, introducing them to traditional and complementary medicine for a decade and a half now. And a lot of our graduates have gone on to become integrative medicine practitioners. At Columbia University, for many years, I was on the board of a Center for Complementary Medicine, which had a lot of funding from the US government, particularly looking at women's health and aging, with very important findings. And in America, there are now more than 50 university medical schools offering training for medical students, research, and clinical services in integrative medicine, combining modern medicine and complementary medicine through the Consortium for Integrative Medicine. And this is a very, very big trend, and I think in the end the rest of the West will catch up. What is important for India is that Ayurveda becomes a very important part of this.
Thank you very much, sir. Thank you for spending your valuable time with us.
Pleasure.
Hope we meet soon.
Thank you, Anjali. Very nice talking with you.